All right, diving in, you guys have given us a really interesting set of materials to work with here.
Yeah, definitely.
Medical texts, case studies, and a lot of it seems to be centered around,
Chronic and terminal illness.
yeah, heavy stuff.
Absolutely.
But, I mean, that's why we do these deep dives, right?
Yeah.
So whether you are here because this is related to your work or for personal reasons, maybe you're just curious, we're going to try to help you make sense of all of it.
Yeah. We'll break down some of the jargon.
Yeah.
Definitely explore some ethical questions. Hopefully give you some new insights along the way.
Okay, perfect. So we're starting off with this excerpt. It's on chronic patients, and I think the big takeaway here is that paramedics really have to kind of be chameleons, right?
Right.
They've got to adapt to each patient's specific needs.
Exactly. And that's especially true with chronic conditions. You can't treat everyone the same.
No, absolutely not. Which brings us to case 29.1. This one throws us right into the, I guess you could say the deep end, right?
Yeah.
So we are in a suburban home. Family is frantic because their mother, who has cancer, is having a really hard time breathing.
Right away, you see this extra layer of complexity because she has a DNR order in place.
Right.
Do not resuscitate, which we'll get into a little bit later.
Yeah, definitely need to unpack that. But she's also under palliative care, which means that they're really focusing on comfort, quality of life. It's not always so black and white. You know?
Exactly. The paramedics get there and find her conscious, but she's confused, her breathing's shallow. But thankfully, she's got strong pulses.
Okay.
Vitals are a bit all over the place. Blood pressure 110/70, but it's irregular. Respirations are at 22, pupils are dilated. 4 + 4 = 8 millimeters, which tells the paramedics her brain might not be getting enough oxygen.
So they go a little bit deeper, notice some wheezing, her abdomen is distended, but no tracheal tugging. For those who aren't familiar, tracheal tugging is when the muscles around the neck pull in with each breath. It's a sign of a serious airway obstruction. So the fact that it's not there, that gives them some clues, but it's still a tricky situation.
Right.
They administer salbutamol, and this is kind of interesting. Her breathing actually improves enough that they're able to transport her to the hospital.
Yeah.
Okay, hold on. Back up a second. Why is that interesting? What does that tell us about what was going on with her?
It suggests that maybe the breathing difficulty wasn't only due to the cancer itself.
Okay.
The salbutamol, that's a bronchodilator, it opens up the airways. So the fact that it worked hints that there might have been something else happening, maybe a bronchospasm, which is like a sudden tightening of the muscles in the airways.
So even though she had a DNR, this intervention was appropriate because it wasn't about restarting her heart. It was about addressing a breathing issue that could potentially be treated. Okay, so that makes sense. This whole scenario, though, does bring up a big question, like how do paramedics balance a patient's wishes, especially when there's a DNR in place, against the concerns of a really frantic family? I mean, those are tough calls, especially in the heat of the moment.
Yeah, they really are.
And I think that leads us perfectly into these test your knowledge questions that come after this case. It really delves into the legality, the ethics surrounding these DNR orders. And something that you mentioned really stuck with me, which is that respecting the patient's wishes is paramount, even if the family disagrees.
Yeah, absolutely. And it's so important that there's clear communication here, right?
Yeah.
DNR does not mean do not treat.
Right.
It simply means do not resuscitate if their heart stops.
There's a big difference. I think a lot of people get that confused. And in a stressful situation like this, those nuances can get lost. So it really highlights the importance of having these honest conversations about end-of-life wishes long before you reach a crisis point.
Definitely. And it takes sensitivity to have those conversations too.
Right.
Yeah, you have to acknowledge the family's grief, understand that they're going through so many emotions at once.
Absolutely. Okay, so we've got this really complex ethical landscape around DNRs. And then we get case 29.2. And this one takes us in a slightly different direction. We're introduced to a man, he's struggling to breathe, and this time he's battling ALS.
Right. And this one adds another layer of difficulty because communication is limited by the progression of this disease.
Yeah. It's debilitating. His son's there, you can tell he's distressed, trying to help the paramedics understand what his dad's going through. The initial assessment, they find that he's conscious, breathing is labored, but again, he's got strong radial pulses. Vitals show blood pressure is 130/80. Respirations are 22, and his pupils are a bit constricted this time. 3 + 3, totaling 6 millimeters.
Right.
They find out he's got a history of ALS, also hypertension. They assess him further. They find shallow respirations, and there's consolidation in the left lower lobe of his lung. What does that mean?
So that means that there's something filling up the air sacs in that part of his lung. Could be fluid, could be pus, even tissue. It's basically a sign that something abnormal is happening there,
Okay.
which could be a complication of ALS or an infection or something else altogether.
Got it. Thanks. So they've got this patient with ALS, difficulty breathing, and this lung issue. What's the plan?
So the focus is going to be on managing his airway, providing oxygen, and then just keeping a close eye on those vitals, make sure everything stays stable.
Okay, this case really made me want to understand ALS better. I thought those test your knowledge questions were actually super helpful for that. Can you kind of give us the rundown? Like, what is ALS?
Yeah, so ALS, also known as Lou Gehrig's disease, it's a progressive neurodegenerative disease. So that means it gets worse over time.
Okay.
And what makes it so devastating is it specifically targets motor neurons, which are the nerve cells that control muscle movement.
And here's the thing, like, we still don't totally understand what causes it.
Right, the exact cause is still unknown. We know it involves this deterioration of upper and lower motor neurons, which are essential for all kinds of things, walking, talking, swallowing, even breathing.
Okay. And that's where something like a BiPAP machine comes in, right? I
Exactly.
remember seeing that in the materials.
Yeah. A BiPAP machine helps with breathing, especially at night. So it can really improve a patient's quality of life by giving their respiratory muscles a break, letting them sleep better.
But sadly, there's no cure for ALS. So it's all about managing symptoms and, like you said, just making the patient as comfortable as possible.
Right.
Which brings us back to these ethical considerations we were talking about earlier. How do we ensure that patients have a say in their care, especially as their condition progresses? How do we balance prolonging life versus maintaining quality of life? Tough questions. And it
Yeah.
seems like communication is key here.
It really is.
But before we get too deep into that, let's take a look at the medications that are mentioned in these materials. We're seeing a mix of drugs here that are commonly used for chronic conditions.
Like the ones we've been discussing.
Like, for example, there's Lasix, which is furosemide, a loop diuretic. So it basically helps the body get rid of excess fluid, which can be a problem for patients with heart failure, kidney disease.
Okay. Then there's Slow K, which is a potassium supplement. Why is that important?
Well, that's important because certain medications, like diuretics, they can deplete potassium levels in the body,
Oh, okay.
which can lead to other health problems.
Got it.
Then we have Pulmicort, brand name for budesonide. It's an inhaled steroid that's used to reduce inflammation in the airways. You'll often see it prescribed for things like asthma and COPD.
Makes sense. And of course, there's Salbutamol, better known as Ventolin.
Yeah.
We saw that in action earlier with the first case.
Yeah.
It's a bronchodilator, so it quickly opens up the airways, gives some relief when someone is struggling to breathe.
Right. And finally, there are two narcotics that are mentioned here. Diloted, which is hydromorphone, and MS-Contin, which is a morphine-based medication. And both of these are used for pain management, which is obviously a crucial part of palliative care.
Absolutely.
So we're seeing this whole mix of medications that are really aimed at managing symptoms, improving quality of life, and addressing that very real issue of pain. I'm already feeling like my brain is doing gymnastics trying to keep up with all this information.
Yeah. It is a lot.
Yeah.
But what really stands out to me is this theme of communication. Whether it's about respecting a DNR, explaining these complex medical terms, helping a family understand the realities of ALS, it all kind of boils down to clear, compassionate communication.
It really does. And for you listening, what's resonating with you so far? What questions are popping up in your mind? Hold on to those thoughts because we're going to keep exploring all of this as we continue our deep dive. You know, we've covered DNRs and ALS and all sorts of medications and just the weight of the decisions that, healthcare professionals and families have to grapple with in these situations. But there's something else in these materials that I think connects to all of this, and that's the stages of grief.
Well, that's a good point. Yeah.
They come up in the test your knowledge section. And, we tend to think of them, I think, in relation to death and dying.
Right.
But I think they have much broader implications, don't they?
Absolutely.
It's really about any kind of loss, isn't it?
Yeah.
Loss of health, loss of independence.
Yeah, loss of the life that you thought you would have.
Exactly.
And all of those things trigger that grieving process.
And it's not a linear thing, is it?
No, not at all.
It's not like you just kind of climb the stages,
Right. Those stages, the denial, anger, bargaining, depression, acceptance, it's not a staircase. It's messy. It's cyclical. You can bounce between them.
Absolutely. And it's not just the patient going through it. It's their family and loved ones too, right?
Exactly. It's like this ripple effect.
Yeah. And I think just recognizing those stages in yourself and others, that's where the real power is, isn't it?
Absolutely. It allows you to validate those emotions,
Yeah.
offer support, meet people where they are.
Without judgment.
Right.
I keep thinking about that son in case 29.2 trying to advocate for his dad with ALS. You can just imagine the mix of emotions he must have been going through.
Oh, for sure. Fear, frustration, maybe even some guilt or anger. And like understanding the stages of grief, it kind of gives us this framework for navigating those emotions, right? Both as individuals and as caregivers.
Yeah. And there's no right or wrong way to grieve, right?
Right. Such a personal experience.
It is. And there's no timeline for healing either. Some people need more time, some people need different kinds of support. Which kind of brings us back to the medical side of things. We saw a whole list of different medications, each one targeting specific symptoms. But, it strikes me that medication is really just one piece of the puzzle, right? Especially when we're talking about chronic and terminal illness.
You're absolutely right. True healing, particularly in these cases, goes so far beyond treating just the physical body.
It's about acknowledging the emotional, the spiritual, even the social needs of the patient. It's about making them feel heard and respected and empowered.
Exactly. And that's where those tough conversations, we were talking about them before, become even more important. What really matters most to this person? What are their hopes and fears? How can we support them on this journey?
It might be managing pain or offering emotional support, even just being present. There's so many ways to contribute to a patient's well-being.
Right. And even those little acts of kindness, they can have such a huge impact, not only on the patient, but their family and loved ones too.
It's about creating this circle of care where everyone feels supported and connected. I'm thinking back to those paramedics we talked about earlier, they walk into these really intense situations, and it's not just about medical procedures, it's about stepping into people's lives at their most vulnerable moments.
Right. And that takes such strength and compassion.
Absolutely. And looking at these cases, it's easy to get kind of bogged down by the weight of it all, but there's also this glimmer of hope there too, isn't there?
I think so. The way healthcare professionals and families try to navigate these challenges,
Hmm.
with grace, with empathy, it's this beautiful reminder that even when you're facing suffering, that human connection can still shine through.
Absolutely. It really is a powerful testament to, I don't know, to the resilience of the human spirit.
It is.
We face these incredibly difficult situations. We wrestle with loss and uncertainty, but we find these ways to support each other, to find meaning, to find purpose.
It's amazing.
And on that note, I think it's a perfect time to pause and hear from you. What's sticking with you? What questions are swirling around in your mind? This is your space to process, to reflect, to really make these issues your own. Okay, so we've really explored the human side of things. The tough choices, the ethical dilemmas, the emotions. But there's another layer that we need to peel back here. And it's one that a lot of people might find intimidating. And that's the legal side.
Yeah, absolutely. I mean, we can't ignore the legal framework around all of this, right?
Yay.
DNR orders, advanced directives, even just the right to refuse treatment. It's not just about medical knowledge. It's about understanding the laws that govern these situations.
And I imagine those laws can get pretty tangled, especially when we're talking about something like, end-of-life care.
Right, yeah, and it gets even more complicated because those laws can vary depending on where you are.
Oh, that makes sense.
So something that's legally sound in one province might not be in another. So both healthcare professionals and patients really need to be aware of the specific laws in their region.
Okay, so it's not just about knowing the law, it's about knowing the right law.
Exactly. And, it's not about memorizing every single legal detail, but having a general awareness of those principles and then knowing where to go to find the right information when you need it.
And I think our source material actually touches on this a little bit. It talks about how crucial it is for paramedics to understand their legal duties and ethical responsibilities when they're responding to these kinds of calls.
Yeah, it is. Yeah, I mean, think about it. They're walking into these very intense situations. Maybe a patient's wishes are clashing with what their family wants, or there's confusion about a DNR. They need to know how to handle that both legally and ethically.
It's a huge responsibility. And again, it highlights how important clear communication and documentation are in these cases.
Oh, absolutely. Yeah, every decision, every action, it all needs to be documented. And it's not just for legal protection, it's so that everyone involved in the patient's care is on the same page.
Yeah, it really is a team effort. Like we were saying before, paramedics rely on information from doctors and nurses, social workers, and everyone needs to be sharing that information in a way that makes sense, that's timely.
especially when time is so critical. I mean, clear communication can literally save lives.
Absolutely. Wow, we have covered so much ground in this deep dive. I'm a little overwhelmed, honestly. What about you? Are there any key takeaways that are really sticking with you?
Yeah. For me, it's this, I guess it's a reminder that healthcare isn't just about the physical stuff.
Right.
It's about respecting a patient's autonomy, their right to make decisions about their own body, and providing care with compassion, and just recognizing that there are all these layers, these medical layers, ethical layers, legal layers, emotional layers, and they're all intertwined.
Yeah, you can't separate them. It's about seeing the whole person, not just a diagnosis or, a set of symptoms.
Exactly. And remembering that each person's experience, their journey, it's unique. There's no one-size-fits-all approach to any of this.
I feel like these cases, these discussions, they've really challenged me to think differently about healthcare, both from a professional perspective and a personal one. I imagine it's been the same for you listening out there.
Yeah, I hope so. And I hope this deep dive has given you, some food for thought, maybe some new insights, some things to think about. But remember, this is just the start, you know?
Yeah.
Keep asking questions, keep learning, and keep having those important conversations.
Because ultimately, it's about living a life that aligns with your values, making choices that feel right for you, and advocating for yourself and the people you love.
Couldn't have said it better myself.
Mhm.
And on that note, we'll leave you with one final thought to kind of ponder. If you were the one in charge of training paramedics to navigate all of these really complex ethical and legal situations, what would you make sure they knew? What would be at the top of your list? Think about it, maybe talk about it with someone, and yeah, let's keep the conversation going. Thanks for joining us for this deep dive.